Hello, everyone. Welcome back to Infectious Disease Revision. This is 28-day course for Mednito. First, we'll talk about HIV screening. Most important and most common question. 36-year-old male patient presented with symptoms of urethritis. Please do screen for HIV. Very important. Young male patient presenting with symptoms of urinary tract infection. You will have to do a HIV screening. Female patient presenting with urethritis, please do think of HIV screening. Patients presenting with sexually transmitted disorders, please do HIV screening. These are the three most common topics they test for HIV screening. And when we talk about HIV screening, there are the patients or there are some of the treatment categories who needs HIV screening, especially in US whenever there is a patient has got tuberculosis will require HIV screening. Patients who are being treated for urinary tract infections, young patients who are being treated for urinary tract infections will need HIV screening. Any patient with other STDs will need HIV screening. We talked so much about HIV screening, but what is the most important and preferred HIV screening test that you will need to do? You'll have to test a P24 antigen and HIV antibodies for screening. Whenever you test a P24 antigen and HIV antibodies, remember we are testing antigens and we are also testing antibodies. That is P24 antigen and HIV antibodies we are testing. Whenever the patient is positive for any of these, if it is a P24 antigen or HIV antibody, you will have to then confirm the test by testing HIV-1 or HIV-2 antibody differentiating immunoassay. Very important. If the patient is being positive for antigen or antibody, please do confirm it by if it is a HIV-1 or HIV-2 antibody, and that is done by immunoassay. Remember, whenever the patient has got negative test for antigen and antibody, but still you suspect HIV, then you'll have to test for plasma HIV RNA testing. This plasma HIV RNA testing is usually tested as a acute HIV question. Whenever in USMLE step 2, you find that this patient might be having acute HIV, that is fever, rash, deteriorating symptoms with chest infection, you'll have to think of acute HIV, and these symptoms present acutely after history of travel, after a history of business trip, or a healthcare worker, or an IV drug abuser, or males having sex with males. Very important. Or people who have sex for money or drugs, or patients who have got HIV positive partners, patient who is homeless. Very important. Patient who is in prison. You will have to test for HIV screening test. If the antigen antibodies are negative, I want you to do a plasma HIV RNA testing. Very important. Whenever the question says that what do you do next, or what is the further management in a patient who has come to your outpatient clinic, who has a history of IV drug abusers, who has a history of multiple sex partners, who is a male who has sex with male, and who is a individual who does work involving physical intimacy, or patient who has got more than one partner, or patient who is homeless, please do select annual HIV screening as an option. Very important question and very important concept. Any of the risk factor patients presenting to your outpatient clinic, what is your next management? What is your recommendation? Please do screening. We discussed this in our previous lectures as well. Any patient who is getting pregnant, please do screen for HIV. Any patient who is at risk of exposure to body fluids, please do HIV screening. Normally, there is a question framed this way saying that a patient is, if a 21-year-old female is brought in to the clinic by her mother. She's about to start her new relationship. On further questioning, the patient mentions that she already had physical intimacy when she was 17 years old. What would you do next? There will be two options that can be there. One is screen for STDs or education and counseling. Please do select screen for sexually transmitted disorders. Very important because she's 21-year old, isn't she? So that's the most important question you'll have to remember. Next, we talk about hepatitis C screening. Hepatitis C screening, the same risk factors, but it does not include STD screening. I want you to remember whenever there is hepatitis C screening that is asked, patient will have history of blood transfusion before 1992. Okay. Patient will be 60-year-old female patient. Then the patient will be having what is the next step in the question? You will find hepatitis C screening. Please make sure you select hepatitis C screening as an option. We'll see how the question is framed. The examiner will be asking you, the patient on routine findings has got an increase in the ALT or abnormal liver function test, or the patient has got a HIV positive status, or the patient is a previous IV drug abuser, or the patient has got chronic kidney disease and now presenting with abnormal liver function test. And what is the next best step you will have to do? Patient whose partner is HCV positive, patient who is a nurse working in a surgical care unit, children who has recently born for a HCV patient, HCV positive patient, that is hepatitis C positive patient. What do? You do hepatitis C screening, please. Remember, hepatitis C screening is not routinely done. Only if the risk factors are present, hepatitis C screening is done. I also want you to remember that whenever you find a question in the exam saying that the 43-year-old male patient presented with history of rash and patient presented with the history of recent travel noticed skin changes. Please think of porphyria cutanea tarda. Then you'll have to do hepatitis C screening. Easily missed answer. Whenever you find a question mentioning the patient has got porphyria cutanea tarda, you will have to do a hepatitis C screening. The patient has not got any acute symptoms, if the examiner is not asking you about the treatment, if the patient comes to you with general outpatient follow-up, please do screen the patient. Next, we talk about gonorrhea screening. Gonorrhea screening, young female who is less than 25 years of age in the question. I want you to select gonorrhea screening as the most important answer. Women who has got multiple sexual partners, please do select gonorrhea screening. Whenever the patient has got multiple sexual partners and there will not be any HIV screening options, you will have to go for gonorrhea options, please. Next, I also want you to understand whenever the patient has got a history of previous STDs, I want you to select gonorrhea screening as one of the most important screening test. However, you will also have to look for the question and will have to differentiate between HIV and gonorrhea as well. Women during pregnancy, please screen for all STDs, no matter what type of STD it is, because it is very important to save the child from prevent the child from acquiring the infections. Next, we talk about syphilis screening. Whenever there is a syphilis screening, I want you to understand that men who have sex with men must be screened for syphilis. That is what you'll have to remember for exam point of view. But it is very unfortunate that they will not test syphilis screening. It is only for pregnant patients they will test for syphilis screening, please. Very important. Next, I want to talk about what is it? Types of vaccines. Types of vaccines. There are three types of vaccines: live attenuated and non-live attenuated. In non-live attenuated, we all know that there are toxoid subunits and conjugate and inactivated vaccines. Live attenuated vaccines, I want you to remember MMR, measles, mumps, and rubella. You will have to carry this card for lifetime, please. Measles, mumps, and rubella is a live vaccine. Rotavirus, influenza virus, which is given intranasally. Yellow fever, varicella zoster, and polio, oral polio is a live virus. Most of the times, live attenuated vaccines, I want you to understand rotavirus when it is vaccinated. In the vaccinated individuals, you will find a question saying that a 2-year-old male boy, 2-year-old child presenting with diarrhea who is vaccinated up to date, vaccinated completely. Think of rotavirus, please. 35-year-old male presenting with sudden onset of diarrhea after admitting to the hospital. Please think of norovirus, please. Very important. Next, I want to talk about subunit vaccine. Hepatitis B is one of my most favorite subunit vaccine. That is what I'll say. The remaining vaccines we can talk as we are going. Whenever in medicine, if you find patient's age 63 or patient age 64, what would you do? Please make sure he will have a booster dose of diphtheria, pertussis, and tetanus vaccine first for every 10 years. That is the most important thing I want you to remember. What is the next step for this patient? He received an influenza vaccine 2 years ago or 18 months ago, and now it is early months of winter. Please give influenza vaccine annually. Next, the most famous question. Patient is diabetic. Patient currently smokes 20 cigarettes per day. Patient drinks 25 units per week. He is 63 years old. What is the next best step you do? Any immunocompromised patients, I am not at all worried about if the patient has got diabetes, smoker, alcohol, heart failure, liver failure, steroids, or anything. Any problem with 63 years old, I want you to select pneumococcal vaccine as one of the most important option, because without pneumococcal vaccine, there will not be step 2 question paper. Remember, if the patient is more than 65, it is the pneumococcal vaccine that we need to give. That is the PCV13 vaccine and PPSV23 vaccine, please. It is the pneumococcal conjugate vaccine and pneumococcal polysaccharide vaccine that I want you to administer for patients age more than 65, no matter what problems he is got. But if the patient is 63 years old and you think that this patient is immunocompromised, please go for pneumococcal polysaccharide vaccine, that is PPSV23 alone. In the question, the most commonly asked is diabetes, smoker, alcohol. If these three are not present, they will ask you about a chronic liver disease patient. Very important. Whenever you find that the patient has got a recent headache, which is because of the CSF leak, or when the patient is got a sickle cell anemia, or when the patient has got asplenia, I want you to understand the STEM points out towards very high risk patients. Whenever there is very high risk patient, age less than 64 or 64, I want you to understand it is the two vaccines for pneumococcus that you will need to give, and examiner will be testing you this. Remember, whenever you think that the patient is immunocompromised and the patient has got age of 63 and is diabetes, smoker, alcohol, you go for PPSV23. PPSV23 is nothing but pneumococcal polysaccharide vaccine. But when the patient is out of the immunocompromised state and is severely high risk, that is easily prone for infections, please do select PCV13, and PPSV23, please. Did you all understand what are all the things that you need to remember when answering the question? Because this will be asked in the exam. I don't want you to go and put a blank face in the exam. Okay. When you think that this patient has got a very high risk of acquiring infections, it is the dual vaccination that we need to give. It is the pneumococcal conjugate vaccine and pneumococcal polysaccharide vaccine. I want you to select, please. Next, we talk about meningococcal vaccine. When I talk about meningococcal vaccine, first most important thing is whenever the patient has got a history of HIV and whenever the patient has got history of meningococcal vaccine that is less than 5 years, please do give a booster dose every 5 years in these patients. Okay. Remember, the meningococcal vaccination is a quadrivalent vaccine. That is, it contains four types. That is A, C, Y, and W135, which is important for step one. I want you to understand whenever the patient is age 11 to 18, first vaccination must be given at 11 to 12 years of age. And when the patient is going out for a military, patient is changing home, patient is going for a dormitory, patient is about to stay in a hostel, patient is about to start a university. Please give meningococcal vaccination as the important vaccination schedule that you will need to follow, please. Very important. Whenever the patient has got more than 18 years and whenever the patient is got immunocompromised, that is whenever the patient has not got any spleen, patient has got splenectomy, patient has got hereditary spherocytosis, patient has got complement deficiency and is traveling to some other areas where meningococcal infection is at risk, then you will have to give meningococcal vaccination, please. Next, I want to talk about influenza vaccine. Whenever influenza vaccine is available, it is available in two forms. It is a live attenuated and one is inactivated. Inactivated, we give intramuscularly. Live attenuated, we give intranasally. Remember, what is the most effective step for this patient? Remember, intranasal vaccine is less effective. That is why we give intramuscular influenza vaccine annually. Whenever we give intramuscular influenza vaccine annually, the question says like this. Patient working in a healthcare, what is the next best recommendation? You will have to go ahead with the intramuscular influenza vaccination annually. Patient is pregnant, what do you have to give? You will have to give intramuscular influenza vaccination. Patient is COPD, give intramuscular vaccination. Very important. It is only the live vaccine. When do you use? When you do not have the option of intramuscular and when you have a stem mentioning that the patient is 35 years old, patient is non-pregnant and patient is healthy, fit, goes to exercise 5 days a week, independent of his own activities, you can select the influenza vaccine, which is live that can be administered. Very important. If the patient has got immunocompromised, you must not give intranasal influenza vaccine. There is this famous question saying that the patient will be started on TNF and what should be avoided. Please avoid live attenuated influenza vaccine or intranasal influenza vaccine that needs to be avoided. Next, I want to talk about yellow fever vaccination. When I talk about yellow fever vaccination, it is the Africa or Central Africa that the patient is going. Whenever the patient has got a HIV and the CD4 count of less than 200, I want to administer him yellow fever vaccine. In USMLE, they will not be asking about allergy to eggs related to yellow fever vaccine. I'm not worried about allergic to vaccine component which contains eggs. But I want you to remember whenever the patient has got stem cell transplantation, I do not want you to give yellow fever vaccination. You will have to give yellow fever vaccination only in HIV patients who has got a CD4 count of more than 200. I'm sorry if I have told in the previous statement that must be given CD4 count less than 200. I take my word. It is contraindicated in patients with CD4 count of less than 200. And it is contraindicated in severely immunocompromised patients. Remember this famous question for yellow fever vaccination. Patient has got DiGeorge syndrome. What do you have to not give? It is the yellow fever vaccination that you must not give. Any live vaccine must not be given. But remember, patient with DiGeorge syndrome, in the question or in the exam, you'll find it in NBMA and other question banks. Yellow fever vaccination must not be given. Whenever the patient is being treated for any high dose, any condition with high dose corticosteroids or TNF alpha antagonist, yellow fever is contraindicated. And remember, all the contraindications, patients who have got all these contraindications, there is a band or there is a thing that the patient must carry whenever he is traveling. I want you to remember that. Next, we talk about pneumococcal vaccine, which we already talked. Next, I want to talk about varicella zoster vaccine. Whenever there is zoster vaccine, it is recommended for all the patients who are more than 60 years. But the question commonly frames that patient is got 50 patient 58-year-old male patient presented to your clinic. What would be the next step or what would you advise? If there is zoster vaccine, please select zoster vaccine, please. Okay. Usually zoster vaccine is not recommended for adults less than 50. I want you to remember this. Next, we talk about that's a zoster vaccine. Oh, they haven't given varicella vaccination here. Varicella vaccination, it is a live vaccine, please remember. So whenever there is a live vaccine, it is contraindicated in HIV of less than 200, CD4 count of less than 200. Remember, varicella vaccination can be given to children, and the first dose can be given at 12 to 15 months, and second dose can be given at 4 to 6 years. In the question, you will commonly find 5 years, please. So, varicella vaccination can be given at 5 years. Next, I want to talk about hepatitis A vaccination. Hepatitis A vaccination, it is usually recommended for patients who are traveling, patients who have men who have sex with men, and patients who have got chronic liver disease, please. Very important. This was asked in the question. This was asked in the exam. Hepatitis A vaccination. Whom do you give? You'll have to make sure that it is the chronic liver disease patients that you need to select. Next, I want to talk about okay, chronic liver failure patients. What vaccinations do you give? Hepatitis A, hepatitis B, diphtheria vaccine, influenza vaccine, and pneumococcal vaccine. What did I say for pneumococcal vaccine? If the patient is got an age of 63 in the question, you can give only polysaccharide vaccine. If the patient has got age of more than 65, it is the dual vaccination for pneumococcal, that is PCV13 and PPSV23 at the age of 65. Whenever you find a patient with the chronic liver failure, I want you to understand that the vaccinations given for the chronic liver failure patients are hepatitis A, hepatitis B, pneumococcal vaccine, influenza vaccine annually, very important, and diphtheria, pertussis, tetanus toxin as well. Very important. Remember, the diphtheria, pertussis, tetanus vaccine is given every 10 years. Next, I want to talk about HPV vaccine. HPV vaccine, please remember, it is usually given at 11 to 12 years, but it can also be given up to the age of 26 years. 26 years in females and 21 in males. Whenever the patient has got, whenever in the question, the examiner mentions the patient is 31-year-old female, do not give HPV vaccine. Please strike it off. It must not be given or it is not recommended for patients age more than 26. In the question, if the patient is fit and well, please, very important. We'll talk about hepatitis HPV vaccination more when we are discussing about cervical cancer. Next comes the most important thing, vaccination for adults with HIV. We already learned that CD4 count less than 200, live vaccines must be contraindicated. But what are the vaccines that you can give for adults with HIV? Hepatitis A, hepatitis B, HPV virus, influenza virus, meningococcal vaccine, pneumococcal vaccine, diphtheria, pertussis, and tetanus can be given. These are the seven most important vaccines I want you to remember. Hepatitis A, hepatitis B, human papilloma virus, influenza virus, meningococcus, all the types, pneumococcus, tetanus, diphtheria, and pertussis. I also want you to understand that